What is myalgic encephalomyelitis or chronic fatigue syndrome? They are both very hard to say and also to understand. So MCAS is a complex neurological disorder that affects various bodily systems, and this can be the brain, the muscles, the immune, and cardiac systems. It is generally characterized as profound and exceptional fatigue, sleep disturbances, pain, and sort of other symptoms that are exacerbated by exertion, essentially. End of the day fatigue. So as it sort of implies in its name, the main or most significant symptom that people will experience is the fatigue. Now, this is generally diagnosed after 6 months, or experiencing this particular symptom profile for 6 months in adults and 3 months in pediatrics. And this particular fatigue worsens with activity and exertion, but it doesn't actually improve with rest. So this is labeled as post-exertional malaise, post-exertional neuroimmune exhaustion, or post-exertional symptom exacerbation, depending on who you're speaking to and what sort of background they come from. So PEN, or PES. So it's not just fatigue. Individuals will also experience sleep disturbances, widespread pain, cognitive issues, sensitivity to light and noise, dizziness, gastrointestinal problems, and flu-like symptoms. Essentially, diagnosis is the process of ruling out anything else that could be going on, and similar symptoms through medical testing. Basically it's a process of elimination to make sure it's nothing else, which is also where the label of syndrome can come from, is that they don't fully understand it in its depth yet. So there is no cure or standardized treatment, and basically the management focuses on symptom management and symptom relief where appropriate. And there's no specific diagnostic testing. As I said, it's more of a process of ruling out. Now, various research across the globe have identified different biological abnormalities, such as abnormal responses to exercise. We've also seen immune system changes. We've also seen gut bacteria alterations, energy production issues, all those kind of things. So there is research being done globally, and there is different understandings behind MCAS and some of the biological factors that can be occurring. So at this stage still, the exact cause of MCAS is unknown, but we do understand that things like infections or environmental toxins, traumas, genetics, or stress can contribute to the onset of being likely to develop something like MCAS. We do also have things like risk factors. So things like age, or sex, or history of other medical conditions can play a role. So with that, actually, regardless of age, ethnicity, or socioeconomic background, about 75 to 80% of individuals diagnosed with MCAS are born female. And approximately 25% of people with MCAS fit what we'd consider more of a severe category, meaning that they are predominantly housebound or bedbound. So this condition, MCAS, is actually estimated to impact up to 250,000 Australians. So it isn't as rare as it is communicated. It's also not extremely common either, but it does impact a significant portion of the population. So it does, as I've already mentioned, fluctuate quite drastically in severity. So some people can work, some people can study, some people are housebound and bedbound, and some will require supports for managing activities of daily living, and maybe even need mobility aids or whatever it might be. So this is why it is labeled as an invisible illness, is you can't actually see it, and it is something that differs quite significantly from person to person, and that could be based on the person and their symptom presentation, but also their comorbidities and what other symptoms they may be experiencing as well. But it is really important, if you know someone with MCAS, not to assume what their condition is like or what their symptom profile is like, because it does vary quite significantly. So I hope you found this video informative. There are people that specialize in this area, such as ourselves at Active Health Clinic, We are kind of few and far between. Not everyone fully understands these illnesses to the extent that we do, and it's really important that you speak to people who know about these conditions and know how to support these conditions safely, because there are a number of triggers that can worsen our state, and it's important to understand what they are and how best to support ourselves. So if you do have any questions, make sure to speak to your medical team, and make sure to reach out to people such as ourselves. Take care.